Septal perforation, or a hole in the nasal septum, can have multiple underlying causes. Understanding these causes helps in better diagnosis and management of this condition. Today, we'll go through the main categories: inflammatory, infectious, traumatic or iatrogenic, neoplastic, and inhalant-related causes. First, inflammatory causes. Inflammation in the nasal tissues can be due to autoimmune conditions or chronic diseases. Examples include sarcoidosis and granulomatosis with polyangiitis. Sarcoidosis leads to clusters of inflammatory cells called granulomas in organs, including the nasal passages, potentially damaging the septum over time. Granulomatosis with polyangiitis causes inflammation of blood vessels, reducing blood flow to the nasal tissue, leading to necrosis and, subsequently, septal perforation. Conditions like systemic lupus erythematosus and Churg-Strauss syndrome can have similar effects through autoimmune responses targeting the nasal lining. Rheumatoid arthritis, though known for joint inflammation, can also affect the nasal septum. Chronic diseases like Crohn's and dermatomyositis may contribute through persistent inflammation. Now, let's move to infectious causes. Infections like syphilis and tuberculosis, especially in advanced stages, can erode nasal tissues, leading to perforation. Invasive fungal sinusitis, which can affect immunocompromised patients, can also spread to the nasal septum. Leishmaniasis, a parasitic infection, and leprosy, affecting skin and mucous membranes, can cause significant nasal damage over time. Rhinoscleroma, a chronic bacterial infection, can cause progressive damage to the nasal cavity, and individuals with AIDS are particularly at risk due to their increased vulnerability to infections. Next, traumatic or iatrogenic causes. Trauma, whether from accidents or medical interventions, is a common cause of septal perforation. Surgeries like septoplasty can sometimes lead to perforation if blood flow to the septum is compromised. Cauterization for nosebleeds, while useful for controlling bleeding, can also damage nearby tissues. Prolonged use of nasogastric tubes can increase the risk too. Everyday habits like nose picking can lead to perforations, especially if the septum is already weakened. Nasal piercings or inserting foreign bodies into the nose, particularly in children, can also damage the nasal septum. Next up, neoplastic causes. Tumors, both benign and malignant, can affect the nasal septum. Conditions like lymphoma and squamous cell carcinoma can directly invade nasal tissues. Melanoma, although more commonly found on the skin, can affect the nasal passages too. Cryoglobulinemia, characterized by abnormal blood proteins, can also contribute by reducing blood flow to the nasal tissues over time. Lastly, let's discuss inhalants. Certain substances inhaled through the nose can be particularly harmful. Steroid nasal sprays, often used for allergies, can thin the nasal lining when overused, increasing the risk of perforation. Decongestants, though helpful for relief, can have long-term adverse effects on nasal tissues. Cocaine use is a well-known cause of septal perforation due to its vasoconstrictive effects, leading to tissue necrosis with repeated use. Industrial exposure to substances like chromic acid or potash fumes can also irritate and damage the nasal lining over time. In summary, septal perforation can arise from a range of causes, whether it's inflammation, infection, trauma, tumors, or exposure to harmful inhalants. Understanding these causes is crucial for effective diagnosis and treatment, especially for medical professionals managing patients with nasal issues.